Today from the Northern Dental Access Center in Bemidji, Minnesota are Erica Lundberg, the dental practice manager, and Jen Welch, the clinical coordinator and licensed dental assistant. Joining them is also Dr. David Collier, a dentist from KOALA Dental Care, and Susan Voigt of the Medica Foundation. We are always excited to hear from Northern Dental Access Center. Today they will talk about how patient support services and community partnerships have proven successful at improving success rates for children referred out of town for pediatric dental care at Northern Dental Access Center. They will describe the process they have in place that has increased referred pediatric treatment completion to nearly 100%, and along the way have built new bridges between pediatric care and low-income families. So join me in welcoming our panelists this morning.
Okay, good morning everyone. Thank you for staying for our presentation. My name is Erica Lundberg. I am the Director of Operations. Jeanne sends her apologies, she couldn't be here today, so you've got her next best thing. Next slide, please. For those of you who are not familiar with Northern Dental Access Center yet, this slide just sort of depicts what, first of all, where we're located. Paul and Babe are like our mayor up there. Our vision and mission, of course, our mission is to provide a dental home for those in need. And a lot of what we do, a lot of the services that we provide are only made possible through our community collaboration and our partnerships that we've established with other agencies in our region and our community. Next slide. This shows that we have been experiencing incredible growth over the last, well, we've been open for about almost 7 years. And 98% of the patients that we serve are enrolled in Medicaid or Minnesota healthcare programs. There is a huge access problem in greater Minnesota, as most of you already know, and we have been working diligently to try to answer that access call. We serve patients in over 20 counties in Minnesota, and we are blessed to have an incredibly energetic team that helps us reach the nearly 14,000 people a year that we are serving now. Okay. Part of why our team is so energized and so empathetic towards the population that we're serving is because not only do we live and work among them, they're our families, our friends, our schoolmates, but we also all go through a training upon orientation with the Ruby Payne framework for understanding poverty. And our cultural competence is based in the fact that we try to meet patients where they are. We don't try to tell them how they should be or teach them how to just be better. We meet them where they are and help eliminate whatever barriers might exist to them getting the care they need, so that then once they have improved health, they can maybe start to be equipped with the tools that they need to live a more healthy life. Okay. One of the important aspects of our team is that we have a patient advocacy group within the clinic that monitors the outreach and support services that we provide, such as transportation assistance or insurance counseling and referral follow-up. And a couple of years ago, the patient advocacy group, decided or evaluated that we were falling short in meeting pediatric referrals. Pediatric referrals were up to 190 children in 2014, and only 37 of those came back as completed with treatment. So what we wanted to do was, it was really an urgent situation. We knew we had to do better. We knew we had the tools. We just hadn't organized them yet. So that's where this project came about. We wanted to ensure that since we were the only dental clinic that a lot of children had access to, we wanted to do better by them. And that's where this project came up. So I'm going to hand it over to Jennifer Welch, who is our dental practice manager, And she is the one who truly spearheaded this project. She's the one who worked with KOALA Dental and worked with the patients one-on-one and delivered outstanding case management. And I'd like you to welcome Jeanne. Thank you.
Hello. As Erica said, our patient advocacy team noticed that we were falling short in educating the patients as to why this was very important to take care of their baby teeth. And we would refer them to pediatric dentists, but they were quite far away. You can go to the next slide. Our closest pediatric dentists that we referred to are in Brainerd and Baxter, and that's still a couple-hour drive from Bemidji, and many of our patients are even farther north of Bemidji, so it was quite a long drive. And we just didn't know how to get patients to see that the baby teeth are important, so our team kind of came up with a different approach, and we enlisted Medica's help to fund our project. You can go to the next slide.
Good morning, everybody. Can you hear me? Whoa, wow. I'm going to have to hold it farther away. I work for the Medica Foundation as a program manager, but I used to work for Apple Tree Dental, so oral health is kind of near and dear to my heart. And we fund a priority called early childhood health, which is where most of our dental and oral health work is done, and that's for kids 0 to 12 years of age. And we totally appreciate the gaps in access that exists across the state, and we totally believe in the tie between oral and physical health. So when we saw this proposal, we just thought it was creative in terms of it wasn't a region that needed to reach out. It was an organization that had a strong history in this area, and it had kind of a creative proposal, which they'll talk more about, but it was reducing some of those trips that the families would need to take to complete their work. So it's going to be, I think you'll hear more about how the model works, but we just looked at our mission is improving access and taking down barriers, and this was a great organization to fund.
As mentioned, here are some of the dental myths that we face having to answer for our patients. So we came up with a project, and we needed a partner, so we contacted Dr. Collier at KOALA Dental, and his team was awesome, very willing to help us out, and we thought we would pilot one event, see if we could get a full day of children for him to do consults on, and we would take on the patient support aspect by confirming appointments. We provided transportation assistance to the patients just to give them that much more incentive to come there. Transportation is a barrier for many of our patients, so we didn't want it to be, especially for this important appointment. Go ahead. Our initial pilot day was in June of 2014, and it was a huge success. I think only one patient out of the 18 missed their appointment, and so we kept Dr. Collier very busy that day. So we continued on with our project, and we wanted to see roughly 80 to 100 children and their families, and just work with them on a comprehensive case management. And by having Dr. Collier and KOALA come to our office, it could eliminate 2 of the 3 trips, save them some travel time. And because one of the things that we had heard was parents would get frustrated that they drive for so many hours just for a consult, even though that is a very important piece, but they wanted work done, and they didn't understand that, so saving that trip was huge. In preparation for our work, my team and I worked with Dr. Collier's team, Aaron, his office manager, and then we also worked with Julie and Mindy to make sure that all of the children were qualified with the insurance that they accept at their office and were within their age range. We scheduled 6 patients on the hour, and I thought that was a lot, but they're very quick. We got the paperwork that KOALA needed, and I sent out a letter to the patients with their appointment time, what they would need to do when they arrived at our clinic, and then I also enclosed the paperwork that they would need to fill out for KOALA, so they had it completed ahead of time. If they needed help with their paperwork, we had staff available to sit in a consult room and just go through that with them. You can go to the next slide. We offered 2 operatories for them to use, and I had 1 to 2 assistants available just to help them get more instruments, help them with our software. We provided secure Wi-Fi access, and then the basic screening supplies. And then we also made a fun take-home bag for the patients with some extra cooler prizes in them. Go ahead. So during our 10 months partnering with KOALA so far this year, they've been to our office seven times. We have scheduled between 16 and 20 children each of those visits. So it's been really great. 17% of the children seen received transportation assistance to Baxter. Others have asked for it to be mailed. Like I said, we helped patients fill out their paperwork, get connected with other services they might need, and just set up their recall appointments. And we offered insurance counseling for 5 patients as well. So 89 children completed their consult screening with KOALA at our office. And I'm very excited to say that 53 of those children have completed their whole treatment plans and are currently cavity-free. And 36 are currently mid-treatment with KOALA. 50 of the children are already set up for their recall appointments in the upcoming months. The 38 children who have not received their initial consult, we still try to contact them monthly, get them set up with Dr. Collier if we can get a hold of them. So they're not forgotten. We make lots of efforts to continue to offer them this wonderful appointment. Our cost, we had an allowance of $1,000 per day for KOALA expenses per visit. We invested in our miscellaneous dental screening supplies, 2 patient advocate staff members per visit, roughly $900 for patient transportation assistance, and then 16 hours per month was dedicated towards patient care coordination and event preparation. We spent a lot of times on the phone contacting the parents, encouraging them to see why this was so important and get their children in for their appointment. We had a few of our patients that were very willing to write how wonderful this was for them. The one that is probably my favorite was Linda's, who had recently got 2 foster children in her home that we had seen previously, and they still had treatment that was referred from like over 6 months to a year ago, and she didn't know where to go, and we just helped her get connected with KOALA, and both of her children that she had brought to us were seen within a month and had all of their treatment completed, so that was really awesome. And our lessons learned, just taking the extra time to sit down and communicate with the patients and educate them as to why this is so important, offer them transportation assistance, and just partnering with people who are motivated to have the same outcome as you was really great.
Sure, I'll go over here. All right, so I'm David. So just to kind of mirror some of these, and I think a lot of the dentists and providers in the room probably can kind of understand a lot of these things, but I feel that the underlying issue that we have with a lot of these parents, as Jen and everybody up here alluded to, is just education. I mean, these parents, don't understand that there's a lot of resources out there for them to use, and just kind of helping them to understand the importance of getting this stuff done. It's kind of easy at the baseline, I feel, when you have a good team that can, help people understand, just kind of wade through the paperwork and all the kind of red tape. Because, I mean, you see some of these, one of the testimonials was we came in May, and a few weeks later we had the treatment done. So it's a pain. It's a pain for everybody to do, but really what it's about is just educating parents the importance of it, and that there are a lot of resources out there that they can use. I mean, getting to me, of course, being the end goal, it's a hard place to get to. The treatment itself is easy. I mean, we all know how to do that. It's getting them in the door and then to follow up. So it was a good relationship with Northern Dental Access and Medica to put this together. We've been seeing the MA population for a long time. I mean, for my full 12 years that I've been doing this, we've been doing it the whole time. And just what she's saying is, mirrored with the statistics. I mean, our statistic failure rate in our office before this pilot program, I mean, we had anywhere from, just in this population, probably a 25 to 40% failure rate, just because they didn't want to show up. And it was like, well, it seems like a lot of work. Their baby teeth, they're going to fall out. What's the big deal? And then lo and behold, a lot of these people end up in the ER with whatever issues that they may have. And I think when you start projects like these, the word will get out. You kind of beat the pavement enough, and people are going to hear, okay, well, this is here. It's easy. Let's do it. And that's a little bit of a double-edged sword, because most of these cases that we saw were done in the OR. And I feel that, unfortunately, maybe some of the negative take-home for that is that these parents say, well, that was easy. My kid had 20 cavities, but it was all done in one appointment. And so we still got to really reinforce the education on this thing. It's not about just getting the treatment done. It's about the follow-through and kind of helping with, the overall health of the kid. So, I mean, that's my take-home message, I guess, is just you really got to educate these parents at the ground floor to really get them, motivated to come in and follow through. That's all I got.
Lazy and just sit here? No. Some of the lessons that we learned is that the collaboration that was developed between Dr. Collier's office and Northern Dental Access Center was unique and very strong. We don't often see as strong of partnerships, especially with a pediatric clinic that's focused on this population and willing to be flexible in their travel and working together with the clinic. So I think that's been, for us, a cornerstone of what we took away is that really unique and powerful partnership that you guys had together. Secondly is, we fund in other areas besides oral health, and behavioral health, oral health, serving people with disabilities. That concept of the case management is really critical. Giving people access may not be enough if you don't give them the support systems that help them get there and carry through with the treatment. So that lesson and seeing that work so strongly in this partnership we thought was great. And then finally, Dr. Collier mentioned this, was just the concept of the reduction in the missed appointments. And that's powerful for two reasons. One is that the clinic is using their resources more efficiently, but two, the kids are getting treatment. The treatment is actually happening, occurring, and being completed. So it just has that effect for both, all the parties in it, and it was just really powerful in this initiative that we've seen to date.
This is our wonderful staff. And feel free to visit our website anytime.